Hello, dear viewers. I, Dr. Prajakta Sahasrabudhe, Associate Professor at Sancheti Institute College of Physiotherapy, welcome all of you to another session of PHYSIO TV. Basically, heart rate variability is a parameter which is usually not assessed regularly in the clinical assessment and which is an important indicator of autonomic dysregulation. So on this topic, we have an expert faculty, Dr. Zahara Polen. She is assistant professor at Srimati Kashibai Navle College of Physiotherapy, Pune. She will be putting light on it, and she's going to give you a general overview about the topic, starting from basically what is heart rate variability, its applicability, and how it can be assessed and how it will be useful in the clinical assessment. Over to you, Dr. Zahara.
Thank you so much, Dr. Prajakta, for the introduction. Hello, I will be discussing about heart rate variability. As Dr. Prajakta rightly put, that it is a underutilized outcome measure as of yet for the cardiovascular autonomic dysregulation. So we will be looking at what is heart rate variability, what are the different parameters that heart rate variability involves, how it is assessed, and in different conditions, how it will be affected and how it can be used as an outcome measure. So can we start?
Yes, we can. You can share your
PPT. Is my PPT visible?
Yes.
Okay. So, like Dr. Prajakta mentioned, it's my PhD topic, which I'm doing on heart rate variability. So I'll give you all an overview of heart rate variability in the different conditions and its use as an outcome measure. What all we will be discussing today is HRV, its background information, what is its definition, how it is generated, what is the meaning of depressed heart rate variability, what are the methodology and terminology of heart rate variability analysis. There are different parameters, the time domain parameters, the frequency domain parameters, what is the interpretation of these parameters, and the clinical value of HRV analysis. We'll also be looking at, in brief, some alternate methods of assessment, which are recent developments. Okay, so let's start. Heart rate variability is the change in time intervals between subsequent heartbeats. So between two RR intervals, the time period that is present is not steady. So it keeps altering. These beat-to-beat alterations that occur in the heart rate, or these differences in the interbeat intervals, is what is termed as heart rate variability. So the healthy heart is not a metronome. It does not beat at a set rate. The oscillations of the healthy heart, or the rhythmic contractions, they are complex and they are constantly changing in nature. This variation and this constantly changing heart rhythm is heart rate variability. So heart rate variability is also gives you an idea of the adaptability of the cardiovascular system in response to demands from the environment or psychological demands. So it allows the cardiovascular system to adjust to sudden physical and psychological demands. In other words, it is the adaptability of the cardiovascular system. And these fluctuations that are present, they are not, they result from complex non-linear interactions among a number of different physiological systems. So you have your autonomic nervous system, you have hormonal regulation, which causes these fluctuations. There is an impact of disease and stress on the heart rate variability, which we will be looking at in the forthcoming slides. So how is heart rate variability generated, or what causes this variation among subsequent heartbeats? So as we all know, the heart has an intrinsic conduction system starting at the sinoatrial node. So there is a rhythmic pacing discharge that occurs from the SA node. These are autorhythmic cells where spontaneous depolarization occurs and it generates the conduction which causes cardiac contraction. But if there was no external influence on this conduction system of the heart, the SA node would set a pacing rate for the heart at about 100 beats per minute. But as we are all aware, the heart rate is at an average of about 70 beats per minute. So this control or this change from 100 to 70 is brought about by regulation of the autonomic nervous system. So heart rate and contractility are regulated by the autonomic nervous system, hormones, and other factors. So heart rate variability is also why is it important? Why should we be assessing heart rate variability? Why, as a clinical parameter, it is important to assess. It is also important as a prognostic parameter. So it is an indicator of the normal neurocardiac function. So the relationship between the neural system and the cardiac system, or the cardiac regulation of the cardiac system by the nervous system. So it provides an insight on the regulatory function of the autonomic nervous system. So this optimizing function, the control of the cardiac beat by the ANS, has an important implication on the cardiovascular health. So HRV gives an insight into the cardiovascular health. Any condition which affects the cardiovascular health will cause depression of the HRV, or will cause this normal variability or adaptability to reduce. So HRV analysis is a non-invasive method for detecting this early autonomic impairment of the heart and thereby detecting any abnormality in your cardiovascular health. So there is a dynamic relationship between the sympathetic and the parasympathetic nervous control of the cardiac function. So the sympathetic drive is through the postganglionic fibers of the paravertebral ganglia between T1 to T4. That is where the sympathetic drive for the cardiac system arises from. The parasympathetic drive is through the vagus. So there is a balance between the sympathetic and the parasympathetic nervous system. At rest, the parasympathetic nervous system predominates and brings the average HR to about 70 to 75 beats per minute, which was set at 100 beats per minute by the autorhythmic cells, is controlled by the parasympathetic nervous system and brought to about 75 beats per minute. Now, other sources other than the autonomic nervous system, other sources of variability include the respiratory sinus arrhythmia, which is the respiration driven speeding or slowing of the heart, which again occurs via the vagus nerve. The baroreceptor reflex, or the changes in the pressures, which have an impact on the heart rate, and rhythmic changes in the vascular tone. All these have an impact on the beat to beat variability that occurs between the heartbeats. So just a quick overview of the sympathetic and parasympathetic nervous control over the heart. So the sympathetic nervous system, as we all know, is responsible for the fight or flight response of the body, where it stimulates the heart's functioning. When the sympathetic nervous system is activated, there would be higher heart rate and increase in the stroke volume. Whereas the parasympathetic nervous system is what is active during periods of calmness and rest. It inhibits the cardiac function. And parasympathetic nervous system acts only after the sympathetic stimulation has taken place. When sympathetic nervous stimulation occurs, it takes about some time, about 3 to 5 seconds, for the cardiac system to respond. So in a fight or flight reaction, the increase in heart rate and stroke volume is not instantaneous. It takes about 3 to 5 seconds to occur, whereas the parasympathetic control, bringing back the heart rate, to its original average happens instantaneously. The heart instantaneously responds to the parasympathetic stimulation. So this is a diagram showing that there are feedback loops that occur from the heart to the CNS and thereby giving stimulus to the ANS to then control the heart rate. So in case of sympathetic stimulation, as you can see that sympathetic stimulation increases, causes a positive impact and increases the heart rate and the stroke volume, whereas parasympathetic stimulation will reduce the heart rate and stroke volume. These also control the heart rate variability. So, heart rate variability is also dependent upon the heart rate. The change in the heart rate will also bring about a change in the variability. The interbeat variation that occurs will happen because of the balance between the sympathetic and the parasympathetic nervous system. So, primarily, when the sympathetic nervous system acts and the heart rate goes up, the heart rate variability reduces. The parasympathetic nervous system, which acts at rest, bringing the heart rate to about 75, is what is responsible for control of the heart rate variability. Okay, and there are other factors such as respiration, blood pressure through the baroreceptor reflex, thermoregulation, and other influences like hormones, stress, etc., which have an impact on the autonomic nervous system, thereby having an impact on heart rate variability. So we discussed about what is heart rate variability. So it is the change in the interbeat intervals. So the RR intervals that occur, the time duration of RR intervals and how it changes. So it's not the same. The RR intervals don't remain the same. They keep varying. Now, how do we measure this variability? So the gold standard of measurement is via continuous ECG recording. So this ECG recording, the ECG strip that is taken is used to analyze and then heart rate variability is taken. The ECG strip has to be at least a few minutes to few seconds. Okay, a few seconds to few minutes. You have ECG recording over different time periods. So it can be over a 24-hour period where a Holter ECG recording is done, and this involves different activity phases of the individual. So during sleep, during physical activity, how the heart rate is responding and how much variability is present. It can even be done for a short term, that is about 5 minutes of duration, or an ultra short term, which is for less than 5 minutes of duration. These are generally done in supine. It can also be done with cardiac autonomous response testing, CART, when the BP response is measured in different positions, in different stimuli. This HRV analysis can also be done along with CART testing. Okay, so now this analysis is generally described under two main headings. So once the ECG recording is taken, it is analyzed, and then the parameters are described under two main headings, that are time domain and frequency domain parameters. So the time domain parameters are between the RR intervals. So the RR intervals are corrected from the long strip, all the artifacts are removed. And the corrected RR intervals are termed as NN intervals. So normalization of the RR intervals gives you the NN intervals. So the NN intervals and its derivatives give you the time domain parameters, or the time domain HRV features. In addition to that, these NN intervals itself undergo interpolation. They are extrapolated into something called a fast Fourier transformation. And this transformation, or this extrapolation and analysis of these NN intervals, gives us the frequency domain HRV features. So we'll look at each one. So the time domain analysis, these indices quantify the amount of variability in the measurement of the interbeat interval. So the time period between successive heartbeats is taken on, like I mentioned prior, on a continuous ECG recording. Each QRS complex is detected. They are the artifacts or uh, uh, are what are filtered, and the normal to normal intervals are determined. So the NN intervals are determined, and then we have these NN intervals are used to compute all the parameters of the time domain analysis. So these are used to calculate a mean of the NN interval in the ECG strip. What is the mean heart rate? What is the difference between the shortest and the longest NN interval? Then also the standard deviation of the NN intervals is taken, which is termed as SDNN. It is the estimate of the overall heart rate variability. Another method, another derivative is the standard deviation of averages of the NN intervals, SDANN, which estimates the long-term components of the heart rate variability. Other parameters obtained from this NN interval itself is the square root of mean squared deviation. So RMSSD values. These give ideas of the short-term components, the long-term components, how these are going to affect the variability. So so these are the time domain parameters. You have NN, mean NN intervals, standard deviation of NN intervals, or the normal to normal intervals, which are nothing but filtered RR intervals. Standard deviation of average of NN, then the root mean squared value, and the square root of the root mean value. After that, there is something called a frequency domain analysis, which is done. So the heart rate spectrum that is obtained, it is separates it into various components based on the frequency of the variation, and quantifies how much is the sympathetic and parasympathetic influence on the heart. So there is a power spectral density analysis. The software which is used to do the HRV analysis, that is going to analyze the time domain variation between the RR intervals under the power spectral density or the fast Fourier transformation analysis, and it is going to convert them into frequency measures. So you have very low frequency, and high frequency. So the very low frequency band is between 0.003 to 0.04 hertz of frequency of the variation. The low frequency band stands somewhere between 0.04 to 0.15 hertz. High frequency band is between 0.15 to 0.4 hertz. Now, what do these different frequency bands denote? So the high frequency band, there are normal values for this which are published. Now, an alteration in the high frequency band will give you an idea of an abnormality of the parasympathetic nervous control on the cardiac system. The low frequency gives you an idea of the sympathetic control. There is something called a low frequency high frequency ratio. Now, LFHF ratio is one of the most important parameters which is measured, and that gives you an idea of the relationship between the sympathetic and parasympathetic control of the cardiac system through the vagus. There is also the total power between right from all the frequency bands, and it gives you how much is the total power of the variation. Okay, now this is just an outlook of some of the parameters, and in a 24-hour recording, which is done using a Holter ECG or a stationary supine 5-minute recording. What are the normative data? I have also mentioned the reference where I have got these normative data from. For Indian population, the availability of normative data is very limited in all the types of uh, measurement, in the short term, in the ultra short term, as well as in the long term or the 24 hours. There is very limited research available on the normative of these various time domain and frequency domain parameters of heart rate variability. So this gives you an idea of the time domain parameters are in milliseconds, which gives you an idea of the standard deviation of NN intervals, standard deviation of average NN, and root mean square of the standard deviations. Whereas this gives you an idea in milliseconds squared, gives you an idea of the total power, the low frequency, high frequency power, as well as the LFHF ratio. So basically, this is showing how heart rate variability exactly is. So the above illustration, the above ECG shows an unhealthy heart rate variability with constant 1 second interval between the heartbeats. Whereas the lower ECG gives you a healthy heart rate variability with minimal variation that occurs between the different heartbeats. So this variation should occur. The heart rate variability, we have the normative data, but it should neither be too high nor should it be too low. There should be optimum heart rate variability. A lower heart rate variability gives the presence of abnormal cardiovascular health. Normally, lower heart rate variability is seen in a lot of disease conditions or is seen in states of stress. Whereas a higher heart rate, towards the higher side, the heart rate variability is considered healthy. But if it's higher than the normal, it gives a risk for developing arrhythmias. Okay, just a second. So, how the autonomic nervous system regulates the heart rate variability. So, when an individual is under resting conditions, their ECG exhibits a high frequency periodic variation. There is a high frequency of variation because, like I told you, the high frequency is showing the parasympathetic nervous control. The parasympathetic nervous control is um, what is dominant at rest. That is why there is going to be a more of high frequency periodic variation, also known, which is known as respiratory sinus arrhythmia, which occurs because of uh, the gating, the respiratory gating of the parasympathetic efferent activity to the heart. Now, this gating, so basically during respiration, the workload changes to the cardiac system, which brings about changes in the heart rate variability. So, heart rate variability is thereby a response to the cardiac workloads and is sensitive to phases of acute stress. Because it is a response to cardiac workloads, it even responds to mental workloads, such as, for example, for now, um, uh, the mental workload of having a presentation will have an impact on my heart rate variability. Okay, so it is sensitive to phases of acute mental as well as physical stress. HRV also reduces with aging, sedentary lifestyle, sometimes even with overtraining in athletes, there is seen to be a drop in the heart rate variability. Now, how is heart rate variability different from arrhythmias? So, there is a constant variability that is occurring. There are differences between the interbeat interval. But how is it different from arrhythmias? So, heart rate variability is a difference in the heart rate as per the changing conditions that occur during the day. the primary morphology of the QRS complex, it remains the same. A high heart rate variability may not may not be equal to a high heart rate. Not always that you have a high heart rate will you have a high heart rate variability. In fact, the reverse is true. As the heart rate increases, the time period between the RR intervals reduces, the heart rate variability reduces slightly. How is this different from an arrhythmia? So an arrhythmia is an irregular heartbeat. The QRS complex, the morphology itself may be abnormal, and it denotes an abnormality in the conduction system. So the normal heart rate rhythm with heart rate variability, whereas abnormal heart rhythms or arrhythmias, the morphology of the QRS complex will change, or you will have an abnormal beat in between, not just changes in your intervals. However, there is a relationship between heart rate variability and arrhythmias. So, lower heart rate variability, when it is uh, associated with disease and acute stress, higher heart rate variability can be a predictor for risk or for development of arrhythmias, especially your tachyarrhythmias. So, a study was conducted on almost 800 individuals, and it was seen that so they were followed up for over a year, and higher heart rate variability was associated with an increased risk of occurrence of atrial fibrillations in these patients. So, um, even an excessive fluctuation of the autonomic system is not good. An excessive autonomic fluctuation, which thereby will show a higher heart rate variability, was considered as an independent risk factor of atrial fibrillation. So higher heart rate variability when it is within the normal limits means that the individual is ready to perform and is less physiologically stressed. A higher, extremely high heart rate variability beyond the normal levels is what will give you an idea of uh, an increased risk for development of arrhythmias. A lower heart rate variability means that there is reduced adaptability of the cardiac system in response to demand. There are more physiological stressors on the cardiac system and occurs in states of fatigue as well. So we discussed about heart rate variability and how it changes. Let's also discuss what are the different factors that affect heart rate variability. So heart rate in itself affects the variability between the interbeat intervals. So there is a dependence upon the cycle length. How much is the RR interval will determine how much is the heart rate variability. As the RR interval goes on reducing, the heart rate variability also goes on reducing. So the higher the HR, the lower is the heart rate variability. Then age. There is a decline of heart rate variability with age. The most dramatic decline occurs between the second and the third decade. So up to the second decade, the heart is extremely adaptable to external stressors, environmental stimuli, physiological loads, etc. Between the second and the third decade, there is a decline. Then it plateaus and remains steady with gradual decline, and then with a reduction in age beyond 60 years, there is an even faster decline in the heart rate variability seen. So there is also some variation between gender and heart rate variability. So in women, there is generally a higher mean HR is seen. The heart rate is relatively higher. However, there is more vagal dominance. So the parasympathetic control is also better. Um, it's not an exact balance between the parasympathetic and the sympathetic control, which brings about the heart rate variability. There are a lot of complex interactions that are present. Now, in spite of vagal dominance in women, there is a higher heart rate. And in men, there is a relative sympathetic nervous system dominance, but their heart rate is lower. With a change in health parameters, HRV will also change. So, increased aerobic fitness with will cause an increase in the time domain measurements or an improvement in the time domain measurements, and uh, uh, these time domain measurements will be an important parameter in predicting health parameters. So, morbidity that occurs because of common mental and physical disorders will be predicted using time domain measures. So, these are different sources of heart rate variability, just summarized. So, intrinsic, we discussed, there are certain intrinsic factors such as the neuroendocrine secretions, the respiratory sinus arrhythmia that occurs. The baroreceptor reflex regulation. Thermoregulation will have an impact on your variability. The circadian rhythms, with the alteration between the day and the night, with a improvement in the variability in the night with a drop in the HR, and improvement in your variability parameters with rest or sleep. And there are certain unknown intrinsic parameters which cause a change in your heart rate rhythms. There are extrinsic sources of alterations in your heart rate variability, activity, mental and physical stress, addictions such as smoking and tobacco consumption, sleep or affection of sleep because of sleep apnea is shown to have a significant impact on the heart rate variability and also increases the risk of individuals developing arrhythmias. So let's discuss how heart rate variability alters in different disease conditions. So when we are faced with patients of different conditions, how their autonomic control of the heart is, and what can studying HRV give us an idea of. So impaired heart rate variability is seen in various scenarios. Age-related decline can be there. The impact of chronic stress can be there. Pathological conditions or a dysfunction in the ANS itself. So reduced HRV indicates a relatively high sympathetic activation. That means that your body is constantly in a state of stimulation, in a state of fight or flight response. This disturbs the regulation of the autonomic nervous system and reduces the adaptability of the cardiovascular system. To there is chronic underlying stress. This constant sympathetic stimulation also causes a depletion in the energy reserves of the body. This reduction in HRV that happens and which indicates that there is a high sympathetic stimulation is associated with various risk factors of cardiovascular disease such as diabetes, hypertension, physical inactivity, smoking, etc. Not only is a reduction in HRV seen with various disease conditions, when taken in healthy individual, it is also a risk, shows a prediction of arrhythmic complications in patients with myocardial infarction. It can predict risk for sudden cardiac death, and it is a parameter which indicates mortality. So it is an outcome which indicates uh, adverse adverse end effects if it is reduced. So these are, we'll discuss heart rate variability, how it is affected in cardiac conditions, so how it is used as an outcome, or what will it cause when cardiac dysfunction is present, and how it can be used to measure changes in the cardiac health when you are intervening to improve cardiac health, how HRV can be used as an outcome measure. So it acts as a predictor of increased cardiovascular mortality and sudden cardiac death following myocardial infarction in patients with coronary artery disease. So the patients with reduced HRV were at a higher risk for sudden cardiac death, and the mortality parameters in them increased. So there was a meta-analysis of cohort studies which followed up the patients who had underlying cardiac conditions or who were diagnosed as cardiovascular disease. For them, for the individual which had lower HRV, there was a higher risk of all-cause death or a hastened mortality which was seen in these individuals. The low frequency power was found to be a powerful predictor of sudden death even in patients with congestive heart failure. So, in heart failure also, they found that studying the HRV could give you an idea of how the patient was going to progress. So, and in MI patients, a large study was done which showed that again cardiac mortality was independently predicted by a reduction in heart rate variability. They have used the parameter of standard deviation of NN intervals. When reduced lesser than 70 milliseconds, it predicted the cardiac mortality. Now, how can you use it as an outcome measure? So there are multiple studies that are present where the HRV improves via participation in exercise training programs. So the individual, especially there were studies conducted between individuals having had an episode of myocardial infarction who underwent an 8-week cardiac rehabilitation program, and there were improvements in HRV depicting an improved autonomic regulation in these individuals and thereby reducing the all-cause mortality for them. Even not only an 8-week cardiac rehabilitation, which was supervised, but also low intensity unsupervised walking program also showed improvements in heart rate variability. So even in congestive heart failure patients, both in supervised aerobic programs, supervised resistance training programs, in home-based training programs, in all of these, heart rate variability was used as an outcome measure to find out how the autonomic or how the exercise program was effective, and it was seen as an improvement in HRV following these exercise programs. Now, HRV and diabetes. So, individuals with diabetes mellitus show early and widespread neuronal degeneration. As we're all aware, the autonomic nervous system will get affected in individuals with diabetes, thereby causing degeneration of both sympathetic and parasympathetic tracts, and which alters their heart rate variability. Now, not only adults with type 2 diabetes, this reduction in heart rate variability is observed in children as well as adolescents with type 1 diabetes mellitus. So, basically, in these children as well, the adaptability of the cardiac system reduces, and they are at a higher risk for cardiac events. Now, HRV indices or the different HRV parameters, reduction in this is associated with how much is the thickness of the carotid intima media, as well as it has been, so basically atherosclerosis factors. It has also been associated with renal deterioration that occurs in diabetics. The decreased HRV in diabetics was also found to be predictive of the cardiovascular morbidity and mortality. Again, a systemic review and meta-analysis of 21 studies with varied exercise interventions. They did endurance training, they did resistance training, high intensity interval training. All these studies were pooled together, and the pooled sample size came up to more than 500 individuals with type 2 diabetes mellitus. These were slightly older individuals. And it was observed that among all the exercise training parameters showed an improvement in the heart rate variability parameters. So SDNN, RMSSD, PNN 50, the high frequency improved, whereas the LFHF ratio reduced, which shows a better relationship between the parasympathetic and sympathetic nervous system. And when stratified by the type of exercise which was most effective, um, so uh, after endurance training, there was an improvement in majority of the heart rate parameters, whereas between the resistance and the high intensity interval training, there was improvement in the LF-HF ratio. Heart rate variability and obesity, the abnormal cardiovascular parameters in obesity, they are linked to sympathovagal imbalance, that is the imbalance between the autonomic nervous system. What are the contributing factors for this? It includes increased visceral fat, increased insulin resistance, which happens because of high BMI, high subcutaneous adipocytes, dyslipidemia, and low grade inflammation. Other factors that influence heart rate variability in obese individuals may include associated comorbidities, altered dietary habits, physical inactivity, emotional stress, and at times even genetic predisposition. Uh, Not directly BMI, but the waist hip ratio is more strongly associated with the altered autonomic dysregulation in obese individuals. As compared to BMI, the waist hip ratio is uh, a better indicator of autonomic dysregulation or is more closely associated with altered heart rate variability. So, exercise and associated weight reduction in obese individuals has been shown to improve the cardiac autonomic modulation by improving the vagal activity. Among severely obese individuals, short duration, high intensity exercise program, along with a calorie restricted diet, showed significant improvement in both time and frequency domain indices of HRV. This study was done in young individuals, whereas a study carried out among Indian population with diabetes showed that even moderate intensity exercise is proven to have beneficial effects. A systematic review was done. So till now we've been talking about adults, but obese children and adolescents that showed an increased HRV. A systematic review was done where all these articles had various types of interventions done. So there were uh, just an increase in physical activity or exercise intervention through sports. And the different interventions all showed improvement in cardiovascular health after physical exercise intervention. HRV is also used as a prognostic factor in different chronic conditions. So, it is used in the prognosis of breast cancer, colorectal cancer. It is also used, autonomic dysfunction or HRV reduction was seen in patients with chronic kidney disease. HRV and sports. Uh, a lot of athletes or a lot of coaches prefer using HRV methods to determine when is the so in elite athletics or in professional athletics, HRV is used to determine how ready or adaptable an athlete is, or if the HRV is reduced, they are less likely to be perform and at a higher risk for injury. So when there is a a rapid change in their training schedules, or there is an overtraining, it is associated with a reduction in HRV. So every time a new training program is introduced in athletes, their HRV parameters are monitored. Now, we've already discussed how exercise has an impact. Weight loss, people who achieved about more than 10% weight loss had 6 times the reduction in recurrences of atrial fibrillation and an improvement in their heart rate variability. There are impact of caffeine, alcohol, sodium intake on the cardiovascular health and thereby on the heart rate variability. Rest or sleep. Sleep quality is linked to heart rhythm, uh, and obstructive sleep apnea is linked to an increase in arrhythmia risks. Uh, HRV was found to be impaired in individuals who did shift work, who had lower sleep times. Relaxation. So, in addition to exercise, relaxation using biofeedback for altering the heart rate variability, using different relaxation techniques, using different breathing techniques. Jacobson's progressive muscle relaxation has been studied with to show that it has an improvement in HRV and um, so also using biofeedback training and different relaxation techniques was studied in a systematic review and meta-analysis and showed an improvement in majority of the heart rate variability parameters. Uh, Exercise, when we discuss exercise and how it improves HRV, is it enhances the vagal tone, reduces the release and sensitivity of the heart to catecholamines, and all these changes are going to protect the cardiac system against disturbances, make it more adaptable to changes. How exercise improves the vagal tone or how it balances the autonomic nervous system is still being studied, but the role of angiotensin 2 and nitric oxide as potential mediators for improvement in HRV with exercise is being hypothesized. So different types of exercise or different exercise interventions were studied in healthy older adults, and it was found that endurance, resistance, coordinative, and multimodal exercise interventions were studied. The beneficial effects were more with relation to endurance, multimodal, and coordinative exercise interventions. Resistance training showed lesser of an impact on the heart rate variability. So we have discussed how the heart rate variability is altered in different conditions, how it can be measured in the lab scenario. So using an ECG, but there are quite a few wearable devices that can be used to measure heart rate variability. So these wearable devices measure the heart rate variability via photoplethysmography. So this is similar to how the pulse oximeter measures the pulse and the oxygen saturation. The same technique is used to measure the heart rate and then extrapolate this into heart rate variability parameters. Um, these devices are commonly used by athletes, especially these are used by runners. There are a lot of wearable chest strap monitoring devices. As you all can see here, this is the polar chest strap. Um, there are pulse oximeter associated apps. So you wear a pulse oximeter and the app such as Elite HRV, which has um, a software for converting this data into heart rate variability parameters is also present. So these were also studied, and there was a high correlation between photoplethysmography and ECG for HRV at rest. So these assessment of these parameters at rest showed a better correlation, but there are a very few studies that have assessed heart rate variability parameters using photoplethysmography devices during exercise. So these photoplethysmography devices use different sensors. Like there is an app called HRV for training, which uses the torchlight in a smartphone as a photoplethysmography sensor, and it helps us detect the HRV. Recently, Google's health division also announced that they're launching a new smartwatch called the Study Watch, which will mainly be used for medical research studies, but that has a system for detecting ECG changes as well. Now, because these are wearable uh, and they are moreover more or less accurate at rest, it makes them an attractive option for HRV monitoring as compared to a lab setup. Summarizing the overview of heart rate variability, uh, the autonomic nervous system has a major role in optimizing the function of the cardiovascular system, and thereby the autonomic nervous system or autonomic dysregulation has important implications on the cardiovascular health. Heart rate variability is a non-invasive, practical, and reproducible measure of the autonomic nervous system function. So, either an ECG or wearable devices, both are non-invasive and have practical usages, as well as the use of HRV as an prognostic factor to detect risk for conditions, to detect mortality in disease conditions. It is also used as an outcome in research parameters or an pharmacotherapy or exercise intervention, how it impacts the cardiovascular health. The availability of these commercially available heart rate monitors has had important implications and permits the ambulatory cardiovascular monitoring, which is not possible by traditional cardiac diagnostics. So it may not always be possible for an individual to come for repeated ECGs, but these commercially available heart rate monitoring systems, like we discussed, the Polar H10, the Elite HRV, the HRV for training app. These make it much easier for assessing the HRV. Although the studies during exercise are limited and it needs more research to um, uh, establish the robustness of these measures, it is still making it much easier for the common people to get their HRV parameters and thereby get a hold on their cardiovascular health. And it is believed that in the near future, heart rate variability will become as common as pulse, blood pressure, or temperature recording in patient charts. It will give us a better idea of their autonomic regulation, and it may even help in finding out or detecting risks in seemingly normal individuals, thereby preventing cardiac events. With this, I'm going to end my presentation and I'm going to request Prajakta ma'am to please open for questions. Thank you so much.
Thank you so much, Dr. Zahara, for giving such a comprehensive overview about heart rate variability. As you correctly mentioned, that autonomic nervous system is kind of very crucial when it comes to maintaining homeostasis of the body. So autonomic nervous system has a lot of implications on various organ systems and vice versa. So if there are a lot of diseases affecting various organs and body systems, it is going to have implication on the working of autonomic nervous system. So yes, so whatever are the pathologies, autonomic nervous system cannot be ignored, cannot be neglected, because there are going to be certain implications in terms of the body functioning and body homeostasis if it is ignored. So with that, I have just a couple of quick questions. It was already very informative session. So just two questions I have.
I'm sorry if I've taken up too much time.
No, it's a wonderful session. So just couple of questions I had. One is that, and as you mentioned that the technological research and everything is also indicating that medical professionals as well as the electronic guys, they are taking interest into the autonomic nervous system assessment research. So which was, entirely laboratory based. They are trying to get into the clinical practice. So my first question is that what are the challenges which could be there when it comes to, taking it from the lab to the clinical practice? And second thing is that when it comes to reassessment of heart rate variability, I may be having a fancy setup I have done. How frequently this heart rate variability has to be assessed in order to know that whether a particular intervention has helped in terms of improving the autonomic dysregulation?
Okay, so first we will discuss what challenges could be there. Like I mentioned, till now, even majority of the researches that have been done in heart rate variability are using the gold standard methods of ECG evaluation and the softwares which then analyze these ECGs for the parameters. The electronic devices that have come up are relatively recent, or there is a lack of research in the parameters of these electronic devices on various conditions, or whatever research is present is also on very small population groups, may not be present in all disease parameters. So it does not give us an idea of how valid these devices will be in the clinical scenario. These devices are commonly right now used mainly by athletes, coaches, etc. But in the clinical scenario or in the research scenario, where our patients would have underlying conditions and the risks are higher, or the variability, assessing the variability is even more crucial. The robustness of these devices has yet not been studied.
Correct.
So we still are largely dependent on the laboratory measures.
Right.
So that in itself, having the setup, having the software in each setup is still a challenge, and these softwares are still an expensive measure.
Right. So for a small setup, it may not be possible. For a larger institute, maybe tertiary care hospitals, they can consider.
Yes.
The larger rehab departments can definitely consider having the software.
Yes.
And how frequently
Okay.
it should be done, the assessment?
So the researches that have been done show, so like I mentioned in cardiac rehab, an 8-week intervention brought about changes in heart rate variability, whereas even relaxation exercises or biofeedback. So this is a real-time variation. So relaxation will also bring about a change in heart rate variability, which will be instantaneous. So even after, say, a 30-minute relaxation session, you do pre and post heart rate variability, you will find changes in the HRV parameters. But how long these changes are going to be consistent for is still to be studied. So majority of the exercise training interventions are at least using about 6 to 8 weeks of intervention and then showing long-term changes in the HRV. Follow-ups have been done for up to a year and the HRV changes have been consistent.
Once again, thank you so much, Dr. Zahara, for having such an informative session. And with this, we come to conclusion of today's Physio TV session. Stay tuned for more sessions in the future. Thank you so much.
Thank you so much. Thank you.